Good morning, everyone, and welcome to our ISI video channel where we discuss various topics related to international students and their health insurance needs. Today, we're going to be discussing everything to do with claims. Joining us is our key account manager, Leah Hammond, who will provide you with a tutorial on how to file and track your claim from start to finish. Leah, thank you so much for being with us today. Can you give us a little bit of background about your role here at ISI and why understanding the claims process is so important for students?
Hi, Sally. Thank you so much for having me. My name is Leah Hammond, and I've been with ISI for almost 5 years now. I started out as a customer service representative, and then I was the customer service manager for 2 years. And from there, I've transitioned into my current role, which is as an account manager for our group clients. So I assist with the day to day to make sure our group plans are running as smoothly as possible. In my experience with ISI, I've guided many international students through the claims process. So I understand why it's so important to be familiar with this process. I know how insurance can be super confusing already. So being familiar with this process is super important to make sure that your claims are getting paid and there's no delay in processing. So today we're going to be going over 5 different claim steps. And as long as you're following these 5 steps, you'll avoid any unnecessary confusion and it will be smooth sailing from there.
Right. It's so important to be familiar with filing a claim on your insurance plan as insurance is so confusing. And I think the claims process is one of the more confusing aspects of it. Could you give us a step by step breakdown of what to do from the time that a student decides they need to go and seek treatment up until the doctor's office receives payment from the insurance company?
Of course. So the claims process really does start before you even get to the doctor, as where you seek treatment will impact how you need to submit your claims to the insurance company. So your plan will generally have something called a PPO network, which is also known as a preferred provider organization. So there will be certain doctors that you will want to visit when you're seeking treatment. Many of our plans here at ISI utilize the United Healthcare Network. So before seeking treatment, you'll want to find an urgent care, a doctor's office, or a walk-in clinic in your area that will accept this network. The United Healthcare Network is a nationwide network. It's one of the largest in the United States. So it should be really easy for you to find a doctor nearby that accepts your insurance plan.
So once a student familiarizes themselves with the network that their plan uses, how can they go about finding a doctor or provider in their area that accepts that network?
Provider networks typically have an online search tool where you can just enter your zip code and you'll be able to find doctors nearby. Or you can always call the number on the back of your insurance ID card for assistance locating a doctor that you can visit. And for our plans, we do have an online search tool that's available on our website directly. So you can go right on our website, enter your zip code, and you'll be able to find those doctors that you can visit. If you want, actually, I can go ahead and I'll show you an example of what one of these online search tools will look like. So you'll see here that this is the homepage of one of our search tools for the United Healthcare Network. You'll be able to enter the city, state, and the zip code that you live in, and you can change location if you're traveling or anything like that. And you'll be able to then search by provider, service, or condition. And you can also search by different categories, so people, places, services, and treatment, etc. I'll go ahead and just quickly show you what it looks like to look for an urgent care. So if you click on this places icon right here, it's going to pull up different facility types that you can look for. So, like hospitals, clinics, specialty centers, things like that. So, if you're looking for an urgent care, you'll just click on the clinics icon, and then you'll click on the urgent care clinic. And that will show you how many different facilities are in your area. So you'll see where I'm located, there are going to be 16 in network facilities nearby. It has the address, the contact information. So you'll be easily able to find a provider in your area. As you can see, this search tool makes it super, super easy to find doctors that you're going to be able to visit that will accept your insurance plan.
Perfect. Yeah, it seems super easy and very user friendly. So once a student has decided to go to an urgent care center, for example,
Mhm.
um, how what do they do once they arrive?
So, once you get to the doctor, it's super important to make sure that you provide the doctor's office with a copy of your insurance ID card. This ID card is going to have all of the information that the doctor's office is going to need in order to submit a claim on your behalf. So, it's very important that you don't forget to bring this with you.
Okay, perfect. And I know that I'm guilty of this. What happens if we forget our ID cards? What should we do?
Yeah, of course. So if you don't have your ID card with you, or if you happen to go to an out of network doctor that doesn't accept your insurance network, you may have to pay for the full amount of the medical services during your visit. And then you'll need to submit your claim to be reimbursed. So you'll need to submit an itemized bill for your services and a receipt to the insurance company, and they'll be able to reimburse you for those expenses.
Yeah, well, that doesn't sound too appetizing. Surely there's something else that can be done here. Is there any other alternative that students have in order for providers to obtain that insurance information?
Exactly. So if you don't have your insurance ID card with you, it does make the claims process a lot more complicated. So again, that
Mhm.
is why it's so important to make sure you do have that ID card. But I will say with our plans here at ISI, once you've purchased them, you will receive a confirmation welcome email, and it will include a copy of that ID card. So you should be able to pull that up on your mobile phone. If you don't have an actual printed copy with you, you can show them that ID card on your phone when you're at the doctor's office. And for any reason, if maybe you don't have that printed copy and you still can't pull up the ID card on your mobile phone, a lot of doctor's offices will let you call them once you've gotten home to
Mhm.
update that insurance information. And that way they can still bill the claim to your insurance company on your behalf.
That sounds like a much better solution than having to pay for everything up front. I know I do the same. I'm just able to easily pull up my insurance information on my cell phone, so that makes it super easy, especially since I often forget it. So now that a student has visited the doctor, what's next in terms of being sure that your visit is processed through the insurance?
So, after you go to the doctor, your next step will be that you will need to complete a claims form and submit this to the insurance company for processing. So, you'll want to make sure that this claims form is completed with as much detail as possible, including the reason for your visit, so there's no holdup in getting your claims processed. And if you've received any other documents from your visit, like medical records, for example, or maybe a discharge summary, you can also submit this documentation to the insurance company.
That all sounds easy enough. So, what about prescription medications? Is there anything special that you need to do if you receive a prescription after your doctor's visit?
So that's a great question. And this is really just going to depend on if your plan has a prescription drug network or not. So if your plan does have one, you'll have access to a prescription card and you can present this at the pharmacy and you'll just have a small fee that you'll need to pay out of pocket. Otherwise, if your plan doesn't include a prescription network, you will have to pay for the full amount of the prescription at the pharmacy. And then you'll just need to submit a claim to be reimbursed. And you'll want to make sure to submit some specific documentation. So you'll need to include a copy of the prescription RX label, which is something that includes the dosage, the name of the doctor, the name of the prescription, the price, and then you'll also want to go ahead and submit a copy of the pharmacy receipt. So this will show that you paid for the prescription out of pocket. And this is something that I see a lot. I do see that either students don't know that they need to submit this, or they'll throw those receipts and those RX labels away. So it's just super important that you hold on to these documents until you've submitted your claim for processing to the insurance company.
Great. It sounds like a good rule of thumb. One thing to remember is just keep those receipts, like you said. Is there any additional documentation that students need to be submitting along with their claims form and those receipts?
So after you've completed that claims form and then you've collected your documentation, like your prescription details that we talked about, or any paperwork that you've received from the doctor's office, you'll also just want to submit a copy of your I-20, your passport, and your visa. So once you have all of that documentation collected, you can go ahead and submit that to the insurance company. And you can do this online or you can do it via email, fax, or mail. I will say that in my experience, the easiest and the quickest way to go ahead and submit your claim is to just do it right online.
Perfect. And surely, when students are doing that all online, is there some sort of place where they're able to upload everything all at once just to make it super easy and user friendly?
Yeah, of course. So all of our plans do have a student zone where you can actually log in to access your plan details, and it's a one-stop shop that includes all of the claim steps. So I'll go ahead and show you my screen so you can see exactly what this looks like in a good example of one of our student zones. Okay, so you'll see this right here. As we talked about earlier, the student zone will include a lot of really great information. So it includes the link to the search for providers. So if you're looking for an in-network provider in your area, you'll be able to access that search tool right here. It also allows you to access the claims forms here as well. So if you're not sure where to go to find those claims forms or you're not sure where to submit them, all of that information will be here. And it's also a really good reminder for the other documents that you need to include, like your I-20, your passport, and your visa. And the next thing that you can do through your Student Zone is you can create your online account so that you can track your claims. So you'll see here that once you register for your account, you'll be able to go in and you'll be able to periodically check on the status of your claims to see where we are in the process of getting them finalized. And it's super important to be familiar with the Student Zone. I would suggest being familiar with this even before you file a claim, just even when you just purchase your plan, so that way you'll know exactly what you need to do before you're seeking treatment.
Great. This all seems like a perfect solution for students to access all of their information. Why is it so important for students to track the status of their claim?
So it is super, super important that you're periodically checking on the status of your claim. Once you've submitted all those documentations that you've received, so the claims form, any prescription information, that doesn't necessarily mean that the claims process is all finished. So sometimes additional information like medical records, for example, can be requested in order to get a claims processed. And without this information, the insurance company isn't going to be able to process your claim. So it is your responsibility to make sure your claim is processed, and that's why you want to check on the status to see if anything else is being requested. Now, if any additional information is requested, the request will be sent to the doctor's office directly, but it is really helpful in my experience if you contact that doctor's office on your own behalf and request those records, just to make sure that the insurance company is receiving all of the necessary information. And you can also request this information right after your visit before you even leave the doctor to avoid any kind of delays.
Perfect. And so once all of this information has been received by the insurance company, how long are we looking at in terms of having a claim processed?
Generally, it takes about 30 to 45 business days, which then brings us to step 5, which is to review your explanation of benefits. So once your claim is processed, an explanation of benefits, which is also known as an EOB, is going to be generated. And this is going to show exactly how your claim was covered. So what amount was paid to the doctor, and if there's any patient responsibility, like your deductible or your coinsurance, that you will need to pay for your services. So you can access those EOBs right through your Student Zone, and you'll be able to see exactly how those claims were processed by the insurance company.
Perfect. So it seems like the Student Zone really has everything there for students. Again, very easy and user friendly, which makes the process all the more streamlined.
Right, it does. The Student Zone is such a good resource, so I definitely suggest that students familiarize themselves with that, so that there's no holdup in their claims process. And I know that we've covered a lot today, so I just wanted to have a quick summary here of those 5 claim steps that we talked about.
Okay, perfect.
So, the first step is to find a doctor, like we mentioned, in your area that accepts your insurance network. Again, you can do this through our online search tool or by calling the insurance company directly. From there, you'll want to make sure to take your insurance ID card. Don't forget to bring that with you when you arrive at the doctor, and then they'll know where to send your claims on your behalf. After that, you'll want to collect all of your claims documents, a completed claims form, any prescription information, any medical records or documents you've received from your doctor, and you can submit this to the insurance company for review. And then you'll want to check on those claims periodically. So don't forget to create your online account through your Student Zone, where you can track the status of the claim to see if any additional information may be needed in order to get your claim processed. And then from there, in 30 to 45 business days, you will get an explanation of benefits that will show how exactly your claim was processed and if there's any patient responsibility that you owe. And from there, you'll be all set and the claims process will be finalized.
Perfect. Thank you so much, Leah, for being able to
Sure.
summarize all of that. Like we've mentioned, it is very challenging to navigate. So, thank you so much. One last question I have for you is what should you do if you have any questions about your claims or if you need help understanding those explanation of benefits?
Of course. So you're always welcome to contact the insurance company directly if you do have claims questions. But I will say that our customer service team here at ISI is exceptional. They're always available to help. So if you have any questions about your claims, how your claim was processed, just to check on the status of the claim, or if you just need a little bit of help understanding that explanation of benefits once your claim has been processed, you can reach out to our customer service team and they'd be happy to assist you further.
Perfect. Well, thank you so much again, Leah. Claims can be so challenging to navigate, so we really appreciate having you here today.
Thank you so much, Sally. I really appreciate it. I hope that I was able to make the claims process a little bit easier. And I was happy to be here today. Thank you.
And as Leah mentioned, you can always contact your insurance company directly regarding the status of your claim, or contact us if you have any questions regarding claims or understanding any part of that process. We hope that all of this information has been helpful, and we look forward to seeing you all next time.